Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or the guests are their own. Enjoy the show.
Hello, my name is Shirley Merritt, and I would like to welcome you to my show. I call it Raspberry Lemonade. Let's talk. First, I'd like to thank God for bringing me to this forum. Secondly, I would like to thank the staff of MS&Me Radio for affording me this opportunity. I get to voice my opinion and talk to you listeners who get to listen to my story and listen to me form my thoughts. And it's just a wonderful experience. My topic for today is MS and the MS hug. Okay, first I'd like to start by talking about exactly what MS is. Multiple sclerosis, as we all know, is a chronic and unpredictable disease of the central nervous system. MS is believed to be an autoimmune condition where the body attacks itself. The target of the attacks is the myelin. It's a protective substance that covers your nerves. This damage to the myelin causes symptoms ranging from double vision to mobility problems and slurred speech. Nerve damage also leads to neuropathic pain. One type of neuropathic pain in people with MS is called the MS hug. Okay, so now I want to define exactly what the MS hug is. The MS hug is a collection, if you will, of symptoms caused by spasms in the intercostal muscles. These are the muscles that are located between your ribs. They hold your ribs in place and they help you to move with flexibility and ease. The MS hug gets its nickname from the way the pain wraps itself around your body like a hug or a girdle, if you will. These involuntary muscle spasms are also called girdling or MS girdling. It's important to note that girdling, however, is not unique to multiple sclerosis. You might also experience this symptom consistent with the MS hug if you have other inflammatory conditions such as transverse myelitis, which is an inflammation of the spinal cord. Costochondritis, which is the inflammation of the cartilage that connects your ribs, can also trigger an MS hug. The symptoms of the MS hug can last from a few seconds to hours at a time. I've even heard people say that theirs last, oh my God, for a day. I can't even imagine that. It's such an awful feeling. Let me tell you what the MS hug feels like. Some people report no pain. Instead, they feel pressure around their waist, torso, or neck. Others experience a band of tingling or burning in the same area. They have sharp stabbing pain or dull, widespread aching pain. Those can also become symptoms of the MS hug. You might experience sensations during an MS hug such as squeezing or crushing, crawling feelings under the skin, hot or cold burning, and pins and needles. Now, those latter three I don't associate with MS hug at all. When I feel crawling feelings under the skin, hot and cold burning, and pins and needles, I relate that to neuropathy or neuropathic pain. Okay, my MS hug is the squeezing and crushing feeling of the rib cage and the lungs. It kind of makes me feel like my lungs won't inflate, I guess, and it makes it hard for me to breathe. Okay, as with other MS symptoms, the MS hug is totally unpredictable, and each person experiences it a little differently. You should report any new pain symptoms to your doctor. You can also experience symptoms similar to an MS hug with these other inflammatory conditions. I mentioned the transverse myelitis and the costochondritis. I also mentioned them earlier. Now, let me tell you what triggers the MS hug. These are some of the triggers. I don't experience it that frequently. It's kind of few and far in between for me, thank God, because it's the most uncomfortable thing that I could ever imagine. All right, heat, stress, and fatigue are situations which your body may not be running at 100% efficiency. Is also a common trigger for MS symptoms, including the MS hug. An increase in symptoms does not necessarily mean your disease has progressed. You may just need to rest more. You may need to cool off, treat a fever that's increasing your body temperature, and you might need to find ways to de-stress. Part of managing pain is knowing what causes pain. So talk to your doctor about any triggers that you've noticed. Now, drug therapy pertaining to the MS hug. Although the MS hug is the result of muscle spasms, the pain you feel is neurologic in nature. In other words, it's nerve pain. And see, I wouldn't have necessarily thought that. This nerve pain can be difficult to resolve, and it is. I usually have to walk around until it just subsides. I can't lie there in bed. If I experience it while I'm sleeping, I can't lie in bed comfortably until it goes away. I have to get up and walk around and try to relieve this very uncomfortable feeling. Sometimes I'll sit in a chair until it goes away, but I find it very hard to lie down. Over-the-counter pain relievers such as ibuprofen and acetaminophen if I'm saying that correctly, acetaminophen, are unlikely to bring relief. Many of the drugs used to treat nerve pain were originally approved for other conditions. The exact way they work against nerve pain is unclear. According to the National MS Society, the drug classes approved to treat the nerve pain of the MS hug are antispasticity medications, anticonvulsant medications, and antidepressant medications. Your doctor may also prescribe a medication like, this is hard for me to pronounce, duloxetine. You can tell I'm reading this one. Hydrochloride or pregabalin. These are drugs that are approved to treat neuropathic pain and diabetes and are used for off-label in MS. Okay, so let me get past those medications. Here are some lifetime adjustments. You can try lifestyle adjustments and home remedies combined with medical treatment to stay comfortable during an MS hug episode. Some people with MS feel better when they wear lightweight, loose clothing. During an episode, try applying pressure to the area with the flat of your hand or wrapping your body with an elastic bandage. I can't imagine actually how that would help. This may help your nervous system translate the feelings of pain or burning into pain-free pressure, which may make you feel better. Now I'm getting this from Healthline Suggestions. Now you may want to just practice some relaxation techniques. Like, this is what I do. I try to deeply breathe. Some people do meditation and sometimes ease discomfort during an episode. I cannot imagine that myself. Because I can't focus when I'm having an MS hug. I wouldn't be able to meditate. Like I said, I just have to walk around to try to, until it subsides. Some patients find that warm compresses or warm bath helps with MS hug symptoms. Mine don't last that long, thank God. So I can't imagine what it would be like if it lasted long enough for me to take a bath. Heat makes symptoms worse in other patients. So, just keep in mind the coping strategies that work for you. Like I said, for me, just to get up and walk around helps the uncomfortable feeling to go away and subside. Just try to deeply breathe. I cannot seem to get a full lung of air in my lungs when this happens. So really, the only thing I can do is walk around. Now, coping with unpredictable symptoms that impact your everyday life can be scary. It is for me, because it actually feels like I cannot breathe. It's very intimidating. Almost 1/3 of patients with MS will have some pain at various times. The MS hug is not life-threatening. It's not a life-threatening symptom. but it can be very uncomfortable and can limit your mobility and your independence if they last long enough. Mine, like I said, don't last that long. Mine tend to last several minutes. They don't even last half an hour, thank God. I just don't know if I could cope with that if they lasted longer than what they do. But again, I've heard of people who say theirs last for hours. When I go to my support group, I hear about people who say that theirs last for hours. Now, the MS hug can depress you. It can make you feel very discouraged, especially if yours are chronic or if they last for a long time. Support groups can play a role in helping people with MS to cope with their symptoms and live healthy lives, as healthy as possible as they possibly can. Now, multiple sclerosis just has a variance of symptoms, debilitating symptoms, and for me, the MS hug I think of it as debilitating. Like I said, thank God my episodes do not last for a long time, because if they lasted longer than they do, I would consider it to be very debilitating. It could be. There's different types of pain that are associated with MS. And that MS hug is just probably one of the worst ones. I just hear, like when I go to my support group and we talk about the MS hug, I hear different scenarios from different people. And everyone describes theirs a little differently. Like I said, it can be very debilitating. People describe it in different ways. Some people say they feel like they're about to die. I feel like I'm having a heart attack. And I can remember times when I've been experiencing that MS hug, and I would walk around, as I stated, and then I would go to the computer and I would Google symptoms of a heart attack, because I would be so afraid that this is what I'm experiencing, a heart attack. This was before I recognized this as an MS hug. I can remember going to my computer and Googling symptoms of a heart attack to try to find out if I'm having a heart attack. It was so scary. I got up in the middle of the night and I started walking around, and I tried to lie down and it just wasn't helping, and it was hard to breathe, and I was like, oh my gosh, I'm dying. I'm getting ready to have a heart attack. And it was just the worst feeling in the world, not knowing what's getting ready to happen to me, wondering if I had time to get to an emergency room, wondering if I needed to call an ambulance, knowing that when you call an ambulance, you automatically have a high bill. I've heard that you can have a bill of like from $250 to $1,000. So I don't know. I guess it depends on your insurance. I think my insurance says it would be about $250. I think if you're at the scene of an accident and an ambulance comes out to you, that's when it's like $1,000 for one visit. I remember being in an accident at the scene of an accident, and the ENT said that if they took me in an ambulance, it would be an automatic $1,000. And I said, what? So I believe if you call an ambulance, it's not as expensive. Um, so, again, when I have an MS hug, when I experience this awful, uncomfortable condition, I often think of, do I need to call an ambulance? Is it that serious? Is it going to go away by itself in a few minutes? Is it going to totally debilitate me? So I just get up and start walking around and hoping it'll go away soon. And it does. So I've learned that when I feel the symptom coming in, which again is very few and far in between, it's not often for me. I just walk around knowing that it's going to subside, it's going to go away soon. Deeply breathe if I can, get air in. It feels like I'm almost hyperventilating. I'm breathing quickly, taking in lots of oxygen. Um, it's just a very uncomfortable situation that I kind of know I'm going to get through. It's just a matter of me being patient while it subsides. Again, it's extremely uncomfortable, but because I've experienced it a few times now, I know it's going to pass. I just have to be patient and allow it to pass normally. It's going to be uncomfortable, but I've come to the realization that it will pass. Not as quickly as I want it to, but I kind of feel like it's going to pass. So I don't worry. It doesn't happen that often with me. It happens maybe, like I said, once every few months I've felt it. Maybe only a few times since I've had MS have I felt this undesirable, extremely uncomfortable condition. I've had MS for 17 years, and like I said, I can count on a few fingers the times that I've had this. Maybe only 3 to 4 times. So, with that said, it will pass. This too shall pass. That's what I believe. So, I'm hoping that this discussion that I'm having is helpful to you. I'm hoping it's putting your mind at ease. I hope it's letting you know that this is a condition that will subside. It's not as serious as we tend to think it is. It's a symptom of multiple sclerosis. It's one of the many symptoms. It does pass. You're not going to die, even though it feels like you are. It is extremely uncomfortable. You know, I'm hoping this talk is helping you to understand that there is a there is a there are different levels of this feeling. Some are very serious and some are very slight. It's a very scary, debilitating symptom, and I don't wish it on anybody. But just knowing that it's going to pass is, it's very reassuring. If you can just stick it out, just pace yourself and just try to breathe, even though it's hard. You can just try to get through it. It's going to pass. Just keep this in mind. Just just do something to try to distract yourself and occupy your mind to think about something else. And if yours lasts for a long time, do some of these other things. Like they say, try the hot bath, the warm compressant. That doesn't work for me. Thank God mine don't last long enough. Like I said, I just pace the floor. I just walk around and just knowing that this will subside. It means everything in the world to me that I know it's going to pass. So, with this being said, I hope this discussion has been helpful to you. I hope it's making it less scary, less intimidating for you. I hope that I'm easing your mind by letting you know it will pass. It's not going to last forever. You're not going to die. It's just a very uncomfortable situation. So we are ending the near end of my show. And I'd like to thank everyone for listening to me. I'd like to thank everyone for keeping an open mind about this symptom and just letting you know it's going to pass. Just you'll get through it. Okay, so I want to say goodbye, and I hope you will join me again next week to listen to another one of my informative shows. I wish you the best. Take care. And I'm signing off now. Okay? Goodbye, everyone. Be blessed.